Hello everyone, you are all welcome to lecture number 1378 and today's topic is cold weather, stroke and heart attack risks. I have gone through a lot of recent publications and in those publications it is mentioned that there is a strong link of temperature to our blood chemistry. That is very serious scientific reason of getting more and more stroke and heart attack during winter season. And the reason is that once our blood circulatory system is disturbed by any means, whether by temperature, by lifestyle, by blood pressure, by inflammation, any reason, means we are in danger. And there is high risk of getting either a stroke or heart attack. Let me make it clear in a very simple way. What is the meaning of stroke and heart attack? Both are dangerous where the blood is involved. If there is some blood restriction due to some clotting or some vasoconstriction which is not reaching to our face and our brain side, then we may get some facial paralytic attack or D-shape of our this face, or sometimes it will attack to your arm. That is called stroke. But heart attack means where there is blood clotting and your heart is not getting enough blood, or there is some restriction where heart is under pressure to work and heart may sink, may fail. That condition is called heart attack. So in winter season, what is happening? We are not aware of the inside chemistry of blood because everybody is not chemist, they are not hematologists, they don't understand the viscosity and fluid condition of blood, and even they don't understand the impact of lifestyle, means diet, food, bad habits that may cause heart attack. And according to statistical data, during very cold season, more than 100% increase of this heart attack and stroke is there. So why it is happening like that? The first condition is the viscosity of our blood. Once it is cold, very cold, then our vessels, blood vessels, they are constricted. That is called vasoconstriction. With that constriction, the space for the blood fluidity is reduced. And when the volume or space is reduced, definitely blood will become more viscous, more thick, I can say. With that change, first your blood pressure will increase, and also there will be some resistance or restriction of supply of blood to your heart, and also your heart will be under pressure or stress to pump because the viscosity is high. And also the blood chemistry goes like that we know blood platelets, they are responsible of clotting, and once viscosity is increased, there is a maximum chance of blood platelets to come very close and they may form clot, that is called thrombosis. And once they are close and formation of thrombosis is there is chance of also inflammation. So you are subjected to so many health conditions. First, high blood pressure will be there. Second, your blood circulation will be disturbed. Third, the chances of blood clotting will be more because the thickness of blood is more, and the other factor is that is inflammation. And you will be having inflammation, and that is also one of the cause of risk of heart attack. So there are a lot of factors associated, and also the other factor that is called hemoconcentration. Hemoconcentration means where the red blood cells, that is called RBC, they will become very close due to constriction, and in this way there is again chance of formation of blood clot. And when such situation is there in cold season, people, they don't care. First thing is that you cover with different layer of clothing with woolen and warm clothes, so that your body from your leg, toe to finger all are covered, so that the chance of effect of this cold on your skin, because once your skin is getting that cold temperature, your skin will try to adjust that cold weather, and in that adjustment lot of changes will occur, and that will bring the complication of all these things. So here I am going to show you some of the images. So in winter season, sometimes you will get quick sweating, and that is called cold sweating, because you will not feel that you are getting some heat or some discomfort, just lot of sweat will appear, and that condition, if it is there, it means that you are having heart attack due to cold weather. Also in cold season, sometimes we are confused if we get some jaw pain which goes up to neck. We think that it may be due to some toothache or some pain in our inside mouth due to some cavity in our teeth. No, it is not like that. You immediately rush to your doctor and get it properly scanned and diagnosed, because that is another indication during cold season, that is your pain in jaw and which is radiating from that up to behind your ear and neck. This is very clear indication on the epithelial layer of your skin, where there are a lot of blood capillaries are becoming dark in blackish or bluish dark color. That clearly indicates that you are suffering from vasoconstriction. Vasoconstriction means all these blood vessels are constricted and the blood flow is restricted, and there is probability of formation of thrombus, that is called blood clot, even in your leg, in your calf, in your finger, in your arm, anywhere where such type of symptoms appear. Immediately you consult your cardiologist. It shows that your blood is having more and more thickness due to vasoconstriction in cold season. This is your total blood circulation, that is called periphery blood circulation, and if there is vasoconstriction, your blood circulation throughout your body from feet to head is in poor condition, and you will be suffering internally due to the increase of viscosity, and because of that reason there is maximum chance of high risk of formation of clot as well as inflammation, and in that situation you consult your cardiologist. You can see here in one leg, thigh, there is bluish or black spot. That is very clear indication of thrombosis, or we call it in simple language blood clotting. And this happen in cold season where temperature is very cold, so that there is vasoconstriction and blood is restricted to flow, viscosity is increased, they will start forming thrombus anywhere in your leg, hand, thigh, calf. And if you see that type of spotting in your blood, please consult your doctor before any emergency comes, like stroke or heart attack. This is really very serious condition of vasoconstriction, where your calf muscles, your knee muscles, you can see that they have the blue color, and then a reddish color means there is chronic inflammation. So now you are suffering from two health condition. One is there is formation of thrombus, means the blood clotting is there due to vasoconstriction, and at the same time, because of that reason, there is muscle inflammation. And if it is combined, these two, definitely there is maximum chance of getting either stroke or heart attack. This is chronic facial paralysis, that is called stroke. And I have already told you the difference in stroke and heart attack is all related to blood circulation, and his face is not getting enough blood circulation, nerve is weak, and because of that reason, that is due to vasoconstriction, blood vessels are constricted. His one side of the face, maybe left side, is deformed, D-shaped. That is called stroke. All of a sudden, if you see that your one arm is non-functional and you cannot activate it for any work, it's non-functional, it shows that you are having arm paralysis, and it is also type of stroke, and that is due to vasoconstriction of your blood flow, and you have got the arm stroke, that is called arm paralysis. Here, as usual, I have given the summary of all those factors, and mainly they are related to your blood circulation. If your blood circulation is correct, your 90% problem is over. And what problem you are getting the stroke or heart attack is because of vasoconstriction, and that is causing lot of problem. And all these things are related to your lifestyle, means your diet, your stress, and the way you are living in the society. And that's why if you are taking care yourself, you don't need to go to even doctor, you can understand very well, unless emergency comes. Otherwise, before that, if you are taking care, then you can avoid the high risk of stroke and heart attack. So all these points I am going to discuss one by one. Number one, cold weather can increase the risk of stroke and heart attack due to several factors, and these factors are listed here. I am going to explain one by one. I have already told you all those things, but I am going to elaborate in a very simple language. Number one, viscosity is chemistry. Blood chemistry here is playing very important role. Viscosity means thickness of blood, something which is thick, where the water content, the fluid condition is drastically reduced because of the cold temperature, and cold temperature is inversely proportional to viscosity. If the temperature will decrease, viscosity will decrease. If temperature will decrease, viscosity will increase. That is the meaning of inversely proportional in science. And that is thickness of blood, and the risk of blood clotting through vasoconstriction and hemoconcentration. Vasoconstriction means all the blood vessels during cold season are constricted towards reduction. Then again, hemoconcentration means, hemo means blood. Blood means mainly RBC and some other blood cells. Their space is reduced, that is called hemoconcentration. In general, changes the blood chemistry. All these two factors are changing the blood chemistry, means viscosity and so many other values. Blood viscosity increases in the cold weather. Direct temperature effect inversely proportional to temperature. Peripheral vasoconstriction means overall body. You have already seen all the images. In response to cold, blood vessels narrows extremely. Arm, leg, finger, toe, from top to bottom, that is peripheral. Everywhere it is constricted to fight the extreme cold. That is the reason, that's why it is constricted. Process is called vasoconstriction. This helps to conserve core body heat. This constriction is actually a natural method to conserve the heat in our core body heat by reducing blood flow to the periphery. This narrow pathway increases the chance of high blood pressure, stroke and heart attack. Number 2, stress hormone release. Once you are stressed, stress doesn't mean only mental tension. Stress, high temperature or very cold temperature, both are stress to your body. So that stress will increase your cortisol, that is called stress hormone, where your heart palpitation rate will be high. That is the symptom where you can understand that the stress hormone excess release is there during anxiety and such type of condition. Palpitation will be there. That is heart rate. Number 3, respiratory infection. In very cold season, I used to always discuss with my family member, children, as a professor of medicinal chemistry, that once there is cold season, please don't take it lightly. Go and take, that is, flu vaccine, and those senior citizens who are above 50 or 60, please take the vaccine against pneumonia. And if you are not doing this, definitely you are killing yourself. Vaccination, anti-flu, antiviral is a must. If you are taking anti-flu vaccine, even in any part of the world, of course in Western countries like Europe and America, it is a must. It is a habit formation. Everybody will go. Once November starts, means cold season has come. There is maximum chance of inflammation and flu. They will go automatically to get anti-flu vaccination. But in India it is not common. In Africa it is not common. They must follow it. And also the vaccination against pneumonic condition, because these two conditions, they are also responsible of inflammation, blood clotting. So the respiratory infection, cold weather may increase the chance of inflammation, respiratory and pneumonic condition, further increases the chance of risk of stroke and heart attack. Number 4, symptoms of heart attack. I have already discussed, but again I am going to clear it more. First is cold sweating. You have seen the image. You will be having very fast, quick sweating in very cold season where it is not expected. That indicates that you should contact your cardiac doctor, cardiologist. And B, increased tiredness and weakness without any reason. You will feel very much tired and very much weak. It shows that your blood circulation is having problem and your heart is not pumping properly and there is chance of stroke and heart attack. C, jaw, arm, hand pain. You have seen the images. That is also one of the indication that your heart is in trouble. Maybe you are having some path towards stroke or heart attack. And numbness in feet. If very frequent numbness is there in your feet, that is also indication that blood circulation is not proper. Blood circulation is very, very important. And E is fast, again fast sweating. If sweating is very fast, again it is another indication. Then safety measures. There are some safety measures we have to take that is related to our diet. There is a myth that during winter season you go and take lot of trans fat, lot of fat, so it will provide lot of heat. Please, that is non-scientific. If you are adding more and more trans fat, more and more deep fried, you are killing yourself. Avoid all these things. Avoid sugary material. Avoid cream, malaidar पूरी, मलाई का लगा के थिक. क्या बात है, दूध का मलाई, बहुत थिक मलाई खा रहे हैं. That is all you are killing. Stop all these things or drastically reduce. गरम गरम जलेबी, lot of sugary material, rasgulla, gulab jamun, you are destroying yourself. So what are those measures you have to take? Dress warmly clothed. Very good clothes, sweater, coat, overcoat. Then you have to cover your finger, hand, leg with very good socks, and make sure that even your head, some ear and all these portions are where sinus is there is well protected, and especially those who are having family history of heart attack and stroke. Numbness and this the rest warmly. Second, reduce salt intake. Drastically reduce salt means sodium chloride. That is also one of the triggering factor during winter season. Reduce it. Then number 3, avoid deep fried food. I have already told you. Then limit sugary foods. Jalebi, malai, imarti, rasgulla, all rubbish. Just reduce drastically. You cannot stop, I know the human weakness, but drastically you can reduce. Occasionally sometimes you may take, because in India, all celebration, all happiness, it starts from sugar, mithai, sugary material. So avoid it. And then avoid drastically temperature. That is very important. If suppose you are in tight compartment where you have the gas and temperature is maintained 25 degrees centigrade, outside temperature is -1 or maybe 5 degree, and immediately if you are going out, no, stop it. That is the triggering factor. Drastic change of the temperature from hot to cold and cold to hot. Slowly you should come. First you come to your some open area, maybe your car garage, veranda or balcony, and then slowly you come down and then enter in car. Avoid drastic temperature and cold drinks. Reduce dairy intake. I have already told you, that is malai and cream. And then stay hydrated. During winter season, we don't feel to get more and more water, but inside our cells are dehydrated, and that dehydration also is very big contributing factor of inflammation, heart attack and stroke. It adds to the viscosity increase in our blood. And number 8 is get vaccinated and manage stress and mental tension. Vaccination is very important. Every human being, this is the problem of to be educated by yourself. Here 90% people, they are not taking antiviral, anti-flu vaccines. In most of the cases, first, that they are not available. Secondly, they are not aware of it. In India also the same thing. Please, once the cold season comes like December, January, make sure that you are vaccinated. Take anti-flu, anti and that is we can say that is antiviral and anti-respiratory attack, that is anemia attack, and then you get the vaccine for your pneumonic condition where your lung is very much under stress, and that is linked to your blood circulation and heart problem. So before it is reaching to pneumonic condition, to viral attack, which is very common, please all of you go and get anti-flu vaccine and anti-pneumonia vaccine. So with this I will stop. Thank you very much for watching the lecture. Now in India or in many parts of the world, we are approaching to our cold weather. So please follow all this, what I have shared my scientific knowledge, so that the high risk of stroke and heart attack is reduced. Once again, thank you very much for watching the lecture.